First and foremost, the forearm comprises of two long bones, known as the radius and the ulna, which are situated beside each other. In the anatomical position, the ulna is the bone that is the most medial to our body, and the radius is closest to our thumb. The primary motion of the forearm is rotation, such as the pronation and supination movement of the arm. When a bone breaks or cracks, the injury is called a fracture. So an ulnar fracture is a break in the ulnar bone, which is one of the two bones in the forearm. Often a fracture to the ulna occurs in combination with other injuries such as sprained or dislocated wrist or elbow, or even a fractured radius. Ulnar fractures can vary in location, severity, and the types, which includes simple fracture, compound fracture, green stick fracture, comminuted fracture, avulsion fracture, olecranon fracture, just to name a few. Next, one of the most commonly causes of the injury that occurs are due to a traumatic weight-bearing force through the wrist, forearm, or elbow, such as a fall onto an outstretched hand or forearm, or a fall onto the point of the elbow. This may occur with any fall, but is particularly common in sports such as skateboarding, snowboarding, and ice skating, where a fall onto a hard surface is unforgiving. Ulnar fractures may also occur due to direct blow to the forearm from a moving object or due to collision with a stationary object such as road accident or contact sports. The symptoms of an ulnar injury varies depending on the extent and location of the fracture. However, in most cases, a fractured ulna will cause bruising, deformity of the forearm, instant pain, swelling, loss of normal arm motion, and numbness in the wrist and hand. In most serious cases, parts of the fractured bone may be visible through broken skin, also known as compound fracture. Usually, an isolated ulnar fracture can be treated with a cast or a fracture brace. And if there is a compound fracture or a significant amount of displacement of the ulnar fracture, a usual treatment is needed which uses plates and screws to secure the fractured bone through surgery. Forearm fractures can also cause further injuries and complications. Some of it are damages to the nerves and blood vessels. This happens because the ends of broken bones are often sharp and can cut or tear surrounding blood vessels or nerves. Secondly, compound fracture can also cause the risk of bone infection. In addition, it can cause non-union. Non-union is a complication where the bone fails to heal. Therefore, patients with diabetes are prone to be affected by this complication. Furthermore, it can also cause compartment syndrome. A compartment syndrome occurs when the pressure from the swelling disrupts the blood supply to the muscles of the forearm. This complication usually occurs by excessive bleeding and significant swelling of the fractured bone. Nevertheless, bones have a remarkable capacity to heal. Forearm bones typically take around 3 to 6 months to be fully healed. The more severe the injury are, however, the longer the recovery may be. Last but not least, physiotherapy treatment is vital in all patients with a fractured ulna to fasten the healing process and to ensure an optimal outcome. One of the most recommended treatment is by exercising. The recommended exercises include flexion and extension of the elbow, where the patients are encouraged to bend and straighten their elbow as far as possible pain-free. Next is the pronation and supination movement of the forearm, where patients rotate their palm up and down as far as possible pain-free. Furthermore is the flexion and extension movement of the wrist, where the wrist is bent forward and backwards as far as possible pain-free. In addition is the wrist side bends, where the wrist is bent towards the medial of the body and laterally away from the body, side by side as far as possible pain-free. Finally is the tennis ball squeeze, where patients are encouraged to squeeze the tennis ball as hard as possible and comfortable without pain. And that's all about it. Thank you.